Good evening, everyone, and welcome to tonight's webinar about transition and money and work. So without further ado, I would love to introduce Kristen Rasparsky.
Hello, everyone. My name is Kristen Rasparsky. Today, we are going to go through working and maintaining benefits. I do a couple different things here at the ARC. I help families navigate through benefits. I also maintain benefits for everybody that we support in our residential services as well. All right, so today, like I said, we're going to talk a lot about transition age and preparing to go to work and benefits and what that means for the people that, whether it's a family member, a son or a daughter, or somebody that you are supporting. We'll talk a little bit about what to do when somebody turns 18. Transitioning from high school to adulthood, what to do when you choose employment, the next steps after that. We're going to talk a little bit about Medicaid as insurance, and then also Medicaid waivers. Medicaid waivers are a big part in transitioning into adulthood and having those supports for you more and more down the line as well. We'll talk about Social Security benefits, and then also saving money. How can you save money and still maintain those benefits? That's always a big question, and it's an important one as well. When a person turns 18, so we'll talk two different scenarios here. If SSI is in place, we want to reapply as an adult. So if somebody has SSI, if a child has SSI, somebody who is under 18, they will most likely get a letter before their 18th birthday reminding them to reapply for SSI. So here, the application is going to look a little different. And some of the information you fill out is going to be a little different as well. Once you reapply for your child or whomever, when they turn 18, this means that they're an adult now. So even if they're still living at home, the parents' resources no longer apply. So for a child who has SSI, that deeming is in place. And once they hit 18, that's no longer in place. So it can be a little weird, awkward, submitting an application or filling out an application as if you were somebody else, but that's the way that we should do it. And at the bottom of the SSI application, there should be a line that says that you fill out if you're filling this out for somebody else. If someone doesn't have SSI in place, I think that's once they turn 18 is a good time to apply for it, to have those benefits in place. Again, you'll go through, you'll fill out the application, and for SSI and for Medicaid, there's an additional little supplement 2-page sheet for somebody who is disabled versus somebody who is just low income. So on the last page of our presentation, there will be a link to the website that will take you directly to the page to apply for SSI. That's SSI. Once somebody turns 18, we want to apply for SSI. We want to get those benefits in place so that as they start working or as they start receiving more support, they have those coming in. And once they have SSI especially, applying for that Medicaid becomes a little easier. SSDI is in place when somebody turns 18. Typically, this is going to be through a parent's benefit. So SSDI, remember, comes from a whole different trust fund. You can call it that. It's for somebody who has already worked, or a child with disabilities can get it off of their parents' record if their parents are retired or if they've passed. So chances are typically SSDI is not going to always be in place for most of our folks turning 18, but if it is, it usually will be through a parent's benefit. Again, the Social Security office is going to most likely send out a disability redetermination form for you to fill out prior to that 18th birthday. And you want to do this as soon as you receive it. So then that way, once they turn 18, those benefits are still in place. Apply for Medicaid. Unfortunately, Missouri is not a state where if you apply for SSI, Medicaid is also automatically applied for. You do have to apply for them separately. But I highly suggest applying for Medicaid when they turn 18, because that will also help you already have the start of those Medicaid waivers if that's something that you might need down the line. During the last year of high school, really work with those school personnel to determine what the appropriate employment path might be. If I know SSD, a lot of schools will work with voc rehab and start getting some of those supports in place. And then there's also other employment networks. DMH has its own system that they've started to develop. So vocational rehab isn't a path that your person might follow. You can go through DMH's supports that they have in place, and that can help somebody as well. Like I said, apply for that Medicaid. So that last year high school, a lot of folks will stay in the high school until they're 21. Once they hit 18, go ahead and apply for Medicaid. Have that in place. Reach out to the regional office for support coordination. Having a support coordinator can really be helpful as you navigate different supports for anybody who, as they might need them. They may not need something currently or quickly, but to have that support coordination in place will really help. And especially if they are going that employment route, they can help get an IEP or an ISP instead of an IEP in place so that voc rehab can put in the supports that that person needs to justify that in their plan. And then just a note on the regional office for support coordination. It'll help any future services that you might need in getting funding for those waivers. There currently and usually is a wait list. So anytime you can be a little proactive will help and make things go a little more quickly. So we're going to really just kind of focus on employment. So somebody has turned 18, we've applied for the Social Security benefits, we've applied for Medicaid, and we're going to go down that employment route. We're going to see what happens. So the next few slides, we're going to talk about Social Security benefits. We'll talk about both SSI and SSDI and the difference between the two. We're going to spend a little more time on SSI because I'm thinking that probably applies to most people over SSDI benefits, but we will talk about both. We're going to talk about the SSI work incentives, things that are in place to help somebody work and stay working. I have a little form that shows you how to calculate an SSI payment, what to report to Social Security to help you avoid an overpayment. And then we'll touch on SSDI and work incentives. So starting off big here, Social Security benefits. We're going to talk about, I wanted to touch on how Social Security determines whether somebody is disabled or not. So for somebody to have those Social Security disability benefits or SSI benefits, which is supplemental security income, they must be determined disabled by Social Security standards. Social Security has one definition for both types of benefits. So Social Security's definition of a disability is that somebody is not able to perform that substantial gainful activity. They have an impairment that is expected to result in death or last at least 12 months. Substantial gainful activity is the limit that Social Security determines each year. That is what they think, if somebody is making this amount of money, they're able to support themselves and they're able to live a substantial life. If they're making under that, it's called the SGA limit. If they're making under that SGA limit, they are more likely to not be able to support themselves and therefore need that disability assistance. There'll be earnings tests, medical tests, and a duration test when you apply for that disability. The medical test is a big one. Super important to really get your doctor's support. There will be forms that they will be asked to fill out and to get those submitted. A lot of times people will get denied that, when they fill out that application. And then a lot of times I see that that's the reason why the doctor didn't submit the form that they were asked to fill out, or there's something missing on it. So really having that physician support when filling out those forms that are given really will help get that Social Security, that SSI application pushed through and show that they have the disability. SSI and SSDI have work incentives and programs and rules to help people maintain employment while keeping their benefits. we are going to talk a little bit about those now. So we're going to talk first about SSI benefits. SSI means Supplemental Security Income, and it can be applied for, anybody can apply for SSI benefits who has a disability. You can apply for your child with SSI benefits. There's a lot more that goes into place with that application versus somebody who is 18 and considered an adult. SSI is intended to help those who are working, to supplement that income to keep them working. Very, very, very important that wages reported monthly to SSA, to Social Security Administration. You can do that. I think a lot of people probably do it through their online portal, or you can call them in, or I fax the ones that we do. I fax those in through my computer. Super important that we're submitting those each month, because that's how Social Security is going to determine their benefit, and that's how you're going to avoid that overpayment. Anybody with SSI shouldn't have any more than $2,000 in assets on the first of the month. That's when Social Security is looking at it, looking at their assets. So we want to make sure that they're not over that $2,000 asset limit, or money may have to be paid back, or they may just stop a check until that is rectified. In 2022, the federal benefit rate in Missouri is $841. So that means anybody's combination that they would get from their SSI payment will be $841. It changes each year, obviously, as the COLA changes. If somebody has SSDI and SSI, their benefit rate is $861. So their combination of benefits won't be higher than that $861. So we're going to talk SSI work incentives. So we're going to touch on 1619B, which is a great work incentive to help somebody maintain their Medicaid if they do begin to make more than the SSI limit, or the SSI break-even point. We're going to talk about IRWIs, which is impairment-related work incentives, and touch a little bit on a PASS, which is help somebody work on a goal related to work and save money that way. So 1619B is a super helpful work incentive. When an employee begins to exceed their income limit for SSI and their SSI benefit comes zero, they're eligible for that 1619B. So this helps maintain Medicaid coverage, but all the other SSI eligibility rules have to stay in place. So we still have to be meeting that Social Security definition of a disability. And then we have to watch that income. So the income limit for Missouri for 2022 is $47,856 per year. They can easily restart. So if they enter into 1619B, you can still easily restart your benefits if they start making less than the federal benefit rate again, or if that break-even point. Keep sending in those pay stubs, because Social Security will adjust that as they see fit. However, if somebody does reach their Social Security check does start becoming zero, and you do need to enter into that 1619B, you will have to call Social Security and tell them you want to be entered into that. That is one thing that they will not do on their own. You do have to call and request that. Like I said, that's a very helpful work incentive to help somebody keep their Medicaid while working, even if they don't have their Social Security benefit anymore. IRWIs, impairment-related work expenses. So these apply to SSDI and SSI beneficiaries, and they apply a little bit differently. So first, with SSI beneficiaries, an IRWI the requirements are the same for both. Sorry. The requirements are the same for both. They have to be paid out of pocket. They have to be related to one's disability and needed for work and approved by Social Security. So super important that all three of those are in place. So paid out of pocket, related to somebody's disability, and needed for work. The example I use is a work uniform isn't going to be an IRWI because yes, it's needed for work. Yes, it's probably paid out of pocket, but it's not related to their disability. Everybody that's working is going to need a uniform. So therefore, that would not be an IRWI. When you have an IRWI, you will submit the receipts each month. You can submit those with your pay stubs, and Social Security will do all of the work after that. So they will take and we'll see this on the next couple slides. They'll take your pay stubs, they'll take your IRWIs, they subtract, and that goes towards your SSI benefit amount for that month. Some examples of an IRWI include transportation, therapies, medication, adaptive equipment, work-related equipment, medical equipment. So for adaptive equipment, that could be something such as somebody needs an iPad to go to work and help them communicate. It could even be, if they need, and then you have to justify it, but if they're working outside the home and they need a ramp in order for them to get from their front door to their car or front door to their transportation, that ramp, one-time expense, you could potentially use as an IRWI as well. Because it's an expense related to their disability. If you are paying for it out of pocket, it can't be covered by any insurances or anything of that nature. And it's needed for work. They need it to get out of their house to go to work. There is a potential that you could cover something like that as an IRWI as well. PASS. PASS stands for Plan to Achieve Self-Support. So this work incentive is a little more detailed. This is a plan, essentially, that helps individuals save money for work-related goals. It does have to be approved by SSA, so it does need to be written out as a plan on how you're going to achieve its goals, and it is time-related. You do have to have a specific, time period in which you'll finish it, and you have to show that you're actually working towards it. So with PASS, SSA counts even less of your income. And like I said, it is time related and we have to document that progress. But it can help pay for trainings. It can help pay or start a business. It can help pay for school equipment or even schooling directly related to their work. So if somebody starts working and they're really enjoying it and they could use a little more education, you can develop a PASS plan. Submit that to Social Security, and as long as they approve it and as long as you continue that documentation, that is a very powerful work incentive that can help save some money on a person's benefit check. So the next slide will kind of show you what all this means. We're going to put it all together here. This is just a very basic calculating your SSI benefit. So starts with your earned income. For SSI, they always take out essentially $85. So they call one the general exclusion, which is $20, and then they take one out, $65 out, which is the earned income exclusion. So $1,300 minus that 85 brings us down to 1,215. And then they divide that by 2. So they're only counting, Social Security is only counting $607.50 of your earned income against your benefit. So next step here, they're going to take the maximum benefit rate, which is at $841 this year, and they're going to subtract the countable income, what they count, so which is only that $607. So this person would get a Social Security benefit check for $233.50. But remember, they're going to get that now including that $1,300. So they could, by just not working and just having that earned income, they're making $1,300, or with their SSI benefit check, they're now making $1,533. So this is how Social Security counts that earned income. They don't count every penny that you make. They subtract that $85 first, then they divide it by 2, and they subtract that from the maximum benefit for that year, which this year is $841, and then that's your SSI benefit. So that's the check that you'll get. And if you add that to your earned income, you're making a little bit more. Here's an example of throwing an IRWI in there. So we have our gross earnings, what somebody makes, that their earned income, which is $500. Same thing here, we're taking out that $85, the general exclusion and the earned income exclusion. And we're taking out their IRWI. So this person had $50 in IRWs for that month. They submitted their receipts to Social Security, and Social Security accepted it and deemed that it was an appropriate IRW. So they subtracted that. So now we're down to $365. So out of that $500, we've gone down to $365 already before we've even divided it by 2. So now Social Security takes the amount minus the $85 minus your IRW, and we're going to divide that by 2. So now Social Security is only counting $182.50 of that $500. Oh, and this is last year's. Sorry about that. I'll have to fix that. So now we're going to do that $841, which is this year's amount, minus $182.50, and then that will become the SSI check that they'll receive in the, for that month. And if you add that back to their $500, that would be the total earnings. So you can see how taking the time to submit those extra work incentives, those IRWs, really can help a benefit check increase and therefore help somebody make more money. The work incentives that are that go with SSI benefits, we talked about that 1619B, which helps you maintain your Medicaid. We talked about IRWs, which are those impairment-related work expenses, making sure they meet all 3 of those requirements. And then we talked a little bit about a PASS plan, which is a little bit more detailed, but it can help somebody really expand their horizons, get more knowledge, help them, really work in a certain, wherever they may want to work, and build the best life that they can out of that. I wanted to touch a little bit on reporting to SSA, what you should report to Social Security. That will help avoid those overpayments, which can be scary. But if we are reporting appropriately, they shouldn't come that frequently. So all income, obviously, we want to submit any of those pay stubs that somebody gets. If somebody gets a bonus and it's based on their performance, we want to submit those. If somebody gets a holiday bonus, a $50 holiday bonus, and everybody in the whole company gets one, or whole workshop gets one, then those don't need to be submitted. Those don't need to be submitted because that's not necessarily performance-based. That's just a gift, if you will. But if there is a performance-based bonus, you do want to submit those. I truthfully think, just by speaking with families, that online portal through SSA is a great way to set those up, and you can submit them fairly easily. Down here, I have the link for that. If somebody moves, if you have, your son or daughter lives with you and then decides, they're able to live on their own, or if they go into residential placement, we want to report that address change to Social Security as well. Make sure that we're sending in those receipts, those early receipts and pay stubs, along with the pay stubs each month, so that you can have more of that money taken out, or less of that money counted, before, and therefore increasing your SSI check. And if SSI payments do stop, call Social Security to request that 1619B status, so that you can keep your Medicaid and have all that in place as well. Social Security disability insurance. So we're going to talk next a little bit about SSDI insurance, or SSDI disability insurance. This, for a lot of our younger folks, probably won't be as applicable unless parents are retired or have passed away, and they are able to have the benefit pulled from them. In order for that to happen, the parent does have to have their child to receive the Childhood Disability Benefit, CDB, and that has to happen prior to the age of 18. And the disability has to be in place also prior to the age of 22. So with that benefit, it allows the child to pull off of their parent's benefit for the rest of their life. So once the parent even passes, they'll continue to get that Social Security disability benefit. And then if the person is working and they turn 65, that disability benefit then just turns into a regular Social Security benefit off of their work history. So like I said, it probably doesn't apply to a lot of our folks, but it's important to talk about. And we'll do that now. So SSDI comes from a trust fund that people pay into as they work. So I'm paying into it, Madeline's paying into it, anybody who's working has that money coming out of their check. Like I said, for a person, a child with disabilities, they can take it out of their parents' pay. So someone may have SSDI if they've worked and paid Social Security taxes. They may still be working, but making under the SGA limit. And we'll talk about that a little bit in a few slides. And then our big one here is going to be an adult child with disabilities, 18 years or under, and the disability began before the age of 22, and their parents are retired or passed. So we're going to start with work incentives for SSDI. Big one here is Ticket to Work. So Ticket to Work is a huge work incentive for SSDI beneficiaries. It connects people with disabilities to free employment services. So again, eligibility, you have to be between 18 and 64. You do have to be receiving that SSI or SSDI benefit. And to get started, you call the Ticket to Work helpline, and the number is here on this purple slide. And they'll help you choose an employment provider. Typically in Missouri, it's VR, vocational rehab. And they will get you set up with the proper employment network from there. So VR is a big umbrella, and under them they have people who do supported employment or employment. They would get you set up with the appropriate agency through that. With that, you'll develop a plan. And as long as you're working on that plan, services are free. It helps you work towards your work goal, keep working. And those services are free as long as, like I said, as long as you're working towards your goals that you set up with VR or whatever agency that you choose to help you. SSDI work incentives, we just talked about trial work period. We are going to talk about the grace period and extended period of eligibility. Trial work period. So all three of these work incentives for SSDI kind of flow together. They flow through their own calendar of events here. So someone with SSDI benefits, when they go back to work or when they start working, they're going to enter into their trial work period. So this is the first set of SSDI work incentives. When a person begins working, they will enter into this trial work period. This can last up to 5 years, or it could last as little as 9 months. It depends on how much money somebody is making. It's any 9 months within a year, within a 5-year period, in which an employee's income does not exceed $970 per month, which is the SGA limit, and they can still maintain their SSDI benefits. Pardon me. The 970 is the trial work period limit, not the SGA limit. We'll talk about SGA in a minute. So 970 is your trial work period limit. There are two different benefit rates, a trial work period benefit rate and your SGA benefit rate. And those come in at 2 different times during your SSDI work incentives. So we're focusing just on that trial work period to start with. So any 9 months in this first 5 years, somebody can go over that trial work period limit and still get their SSDI benefits. All the other months in that first 5 years, they will still receive a check. So I'm getting a paycheck for $700 a month, and then I'm getting my SSDI check for $300, $400, $800 a month, however much that might look like. So that is a great work incentive to start working, to see if you can work and maintain work and still get a benefit check while getting a paycheck. So you're getting both of those benefits. And if for some, 1 month, maybe you work a couple extra hours and you make $1,000 during that month, that'll put one trial work month off of your counts, one off of your 9 months, and now you have 8 left. So in the next, maybe 2 months later, you do another one, so now you have 7 left. So it's just going to keep counting down. And again, that's why it's important to submit those pay stubs to Social Security so that They can maintain those trial work periods and help you ensure that you still get your benefit check, and that you don't go over those trial work months, and then therefore might have that overpayment. So keep submitting those pay stubs, super important. So once somebody reaches the end of their trial work period, like I said, it could be 9 months, it could be 5 years, it could be 3.5 years. It just depends on how much money somebody is making and when they go over that limit, that trial work period limit. That is all set by Social Security each year, and it changes each year. So once they've reached the end of their trial work period, they enter into the next work incentive, which is the extended period of eligibility, or EPE. So EPE can last up to 3 years. It's a 3-year span that gives an employee benefits for any month that they don't earn more than that SGA limit. So now we're not talking about any trial work period limits. We're talking about our SGA limit. So we're at that $1,350 for 2022 for this year. So anytime somebody is earning less than $1,350, doesn't matter. They're still getting that benefit check. Once they hit $1,351, that starts their this next work incentive that called the expedited reinstatement. Oh no, it doesn't. Once they reach that they're making $1,351 in that 3-year span. They have 3 months that goes into our grace period, and we're going to talk about that on the next slide. So if someone is working, they get their SSDI benefit, and they are making less than the SGA for that year, they'll continue to get their benefit check, and they don't have to worry about their benefits stopping. Once they reach over that SGA limit, there's a couple different work incentives in place here that will help you maintain that benefit or reinstate it. But that SGA limit is that super important number that is your limit before your benefits will be adjusted. We're going to skip this expedited reinstatement for 1 second and go to the grace period. So like I said, if you are working and 1 month you make $1,351, you're over that SGA limit, you enter into your grace period. So this is a period of 3 months where someone will still continue to get their benefit check, no matter how much they're making. And then after that, your disability benefits would cease, they would stop. So you can continue, even if you're making $1,351, $1,355, $1,353, that's your grace period. And you're still gonna get that benefit check because you have 3 months of a grace period. And then after that, if you're continuing to make over that SGA limit, your benefit check will stop. However, if you start making under SGA again, your benefit limit will restart. There's a lot that goes into it. It can seem confusing, but the biggest thing is just that SGA monthly limit. So I want to pull back here. So we talked about the extended period of eligibility, which is that 3-year span. So if you're not making SGA, you're still going to get your benefit check in addition to your paycheck. Once you hit that SGA limit, you have a 3-month span, which is called your grace period, where you can still get your benefit check and still be making a little bit over. And then then your benefit check might stop. But after that 3-year span, or however long that takes, you enter into your expedited reinstatement. So this allows an employee to reinstate their Social Security if their income drops below that SGA again. So you have 5 years. If you start working really hard, and then something happens and your disability and your impairment allows you can't work as much anymore, and you fall below that SGA limit, then you can reinstate those benefits, and you can still have your benefit check, and you can still have your paycheck coming in with that expedited reinstatement. So there's a big chunk of time where somebody can be working if they have that SSDI benefit and still get their benefit check in addition to their paycheck. There's a lot of supports in place to help somebody maintain that eligibility throughout their whole work history here. So wrapping all of this Social Security benefits up, So really what it means is work. Try to work. If you want to work and you're looking at something and it looks exciting and you want to do it, let's give it a shot. There's so many incentives and so much support in place to help somebody maintain work and stay working. Both SSI and SSDI benefits have incentives in place, like I just said. But make sure that you are willing and able to do all that extra work, that leg work, to maintain your benefits and avoid overpayment. So it might be submitting those receipts for IRWEs, those impairment-related work expenses. It's definitely submitting those pay stubs every month. And really, bottom line is, if you're doing that extra work, if you're submitting those pay stubs, if you're submitting those receipts, Social Security will do their job in showing what your benefits should be. And a lot of times you're going to earn a little bit more money than you would without those benefits in place. Well, we will move on from Social Security benefits. I know that's a lot to take in. I know, and there's still things that I didn't cover, and that you'll all have my email address, and I'm more than happy to talk you through anything. That's just a big, high level umbrella of what Social Security work incentives there are to help somebody work or maintain work. So next up, we're going to talk about a little bit about Medicaid as a health insurance, Medicaid waivers, and then ABLE accounts. Medicaid as insurance. In Missouri, it's called MoHealthNet. So you might see that MHN is abbreviation as well. Began in 1965 for funding for low-income individuals and people with disabilities. So even if for a family member who might be under the age of 18 and isn't necessarily low income because of parents, there is also Medicaid for people with disabilities as well. But so there is a different application, or it's the same application with a supplement for somebody with a disability who may not necessarily be that low income, but does have a disability and needs that support in place. For 2022, the monthly net income for Medicaid is $914. We'll touch a little bit about a spend down with this. With Medicaid, it's a great tool for somebody with a disability to use to maintain their Medicaid benefits. A person with Medicaid does have to have $5,000 or less in qualifying assets. So there's things that Medicaid counts and things that Medicaid doesn't count. For instance, they're not going to count the house that you live in or one car as an asset. Cash they are going to count, what you have in your bank account. They're going to look at that. There's a list on their website of what they count as a qualifying asset or not. And then also, so with Medicaid, you have eligibility through the Family Support Division. So a lot of your communication is going to come from a place called Family Support Division. That's what you'll see on your documentation a lot when you get mailings, or you'll see it from MoHealthNet. Side note, just because it's come up a couple of times, Medicaid and Social Security will only send correspondence via mail. So if you ever get a phone call asking about, a new Medicaid card or something regarding Social Security, don't share any information because most likely it's not real. It could be a scam because both Medicaid, DSS, Social Security, they're only going to communicate via mail, actual physical mailbox mail. So Medicaid, that's a little bit about Medicaid as a health insurance. Typically Medicaid will cover a lot of expenses. If somebody has Medicare or another insurance, that's going to pay first, and then Medicaid will come in and supplement and pay after that. So if somebody has SSDI benefits, they automatically will begin to get Medicare after 24 months, no matter their age. So in that instance, if somebody is, let's say, they started getting SSDI benefits at 18, they hit 20, and now they're getting Medicare. They go to the doctor. We want to show that Medicare card first, and then the Medicaid card. Medicare will pay, and then Medicaid will supplement that. So flipping over to Medicaid waivers. First step to obtain a Medicaid waiver is to apply for Medicaid. We want to have that Medicaid in place, and super important to maintain your Medicaid. if you do have that waiver funding in place, because they do go hand in hand. So Medicaid waivers, they are called HCBS, or Home and Community-Based Services. These were developed to help people who would normally have to live in a nursing facility or other hospital facility, live and have access to their community, and have the support that they need without having to be institutionalized. So like I said, somebody does have to have Medicaid to receive a waiver. There are 4 of them. We'll touch a little bit about them here in the next slide, I believe. And they typically have a wait list. So first step here is really getting that support coordination through the regional office. So we talked a little bit about that up when we talked about somebody turning 18. We want to get that support coordination going. So calling the regional office and setting up a time for intake with them. And then, letting them know that, you're interested in those waiver services. Most likely, I think for a lot of folks, the community support waiver or the comprehensive waiver are going to be your 2 with the biggest wait list, but then also the 2 that are going to cover most of the funding that you would need. So here we have just a summary of each of the waivers and what they cover. So the Missouri Children with Developmental Disabilities waivers for children used to be called the Sarah Lopez waiver. Partnership for Hope, the funding dollar amount for that is pretty small, $12,362 per year. So you have that funding limit, which is quite a bit, about half as much as the community support waiver, which we'll talk about in a minute. But that can help with different things such as career planning. That's career planning through DMH. It can help with day programs. Some dental can be covered through that funding. Job development, therapies, transportation. And then the eligibility requirements for the next 2 that we're going to talk about are the same as that Partnership for Hope. They do have to have that Medicaid in place, be eligible for DD services. So that's your regional center service, and then meet that ICF/ID level of care, and meets your criteria. And so if it is an emergency, you do meet that criteria as well. So the community support waiver and the comprehensive waiver, we're going to talk about those 2. Touch on those 2 a little bit next. Like I said, those are going to be your more popular ones that most people have in place. Community support waiver is a great waiver for folks who are still living at home. That they might need transportation support. They might need day services, something to do during the day. Maybe it's that career planning through DMH. If they're not ready for voc rehab yet, and they can do career planning through DMH, that can help through the community support waiver as well. And like I said, it can help with transportation and respite services. And a comprehensive waiver is your big guy. So this one's the biggest thing here is that the funding, you have your residential services. So anybody who is supported here at the ARC in our residential services, a lot of them have the comprehensive waiver in place. So that funding is coming in to help them be with us or any other agency that is similar to us in the St. Louis area. They would take that comprehensive waiver, and that would help with those residential services. So the big part here is making sure that we have that Medicaid in place, and that support coordination through DMH started, so that we can get on the wait list for any of those services that you might need in the future. So that's Medicaid waivers and Medicaid as an insurance. So let's talk a little bit about saving money. So ABLE accounts. So we talked a little bit, I mentioned ABLE accounts a little earlier when we had the question about giving checks to a parent to save money. So instead of doing that, an ABLE account might be a great way to save that money. So then it doesn't appear that you're hiding the money or giving the money, to somebody else and then expecting cash in that return. So an ABLE account allows an individual with a disability to save up to $16,000 a year without losing their benefits. They used to be $15,000. They upped it by $1,000 in 2022, so that's kind of nice. And then they have a lifetime max of $100,000. So if somebody is able to save $100,000, which is awesome, their benefits will just be suspended. So they don't even terminate benefits at that point. They just suspend them until they get back down to underneath that $100,000. So that's also a nice benefit as well. The ABLE account is similar to a 529 college savings plan. So it is a tax-free benefit, and you are able to earn interest. There's different selections that you can have interest-wise, and there's also one that's called Bank Safe, which is just your federally insured option as well. So that's your safest one. So with an ABLE account, it's a great place for somebody who is working to contribute money into that. And then if somebody does need to take money out of it, it does need to go towards a qualified disability expense. But that is a wide open range of things. They're all listed on the MoABLE website. Like I said, they can go towards any daily living expenses. It can go towards rent. If it goes towards rent, it does need to be deposited or withdrawn and then used in that same month. So let's say you have $500 of rent a month. You can't take out $1,000 and use $500 in March and $500 in April. It has to be done in that same month. So rent is a little bit of a tricky one, but it's all explained on their website and throughout all the information that you see in any of the ABLE account pamphlets and such. It can go towards rent, it can go towards utilities, daily living expenses or a qualified disability expense, adaptive equipment, even transportation, anything that is going to help achieve a better life experience, which is what ABLE stands for, can go towards those qualified disability expenses. The money does not count as a resource. So if you're filling out a Social Security application, or if you have a disability review coming up, that money does not count. However, if somebody does have SSI benefits, when you open the account, you do have to report that to Social Security. But after you report that one time, you don't have to typically do anything unless somebody requests something, which I don't think happens that frequently. Just make sure that you're maintaining what you're taking out and what you're spending that money on to justify those qualified disability expenses. The website here is also on the last slide that we have with all the different websites. So just a quick summary of the plethora of things that we talked about today. Use those supports at school that last year before somebody graduates, even 2 years before they graduate, to determine if employment is the right track. Talk with Voc Rehab, get them set up at different employment places that they have in place, whether it's a workshop, whether it's Goodwill, YMCA, they all have different things in place to help somebody who is looking to see if employment's the right course for them. When someone reaches 18, let's apply for that Medicaid. And if you want, I would highly suggest that Medicaid, the SSI benefits, I mean, that's hit or miss depending on if you think that, the person that you're applying for is going to need that extra income. If you want to, really work on having somebody, work on paying for their portion of their rent or their utilities, it's nice to have that benefit check coming in to kind of supplement that and to show, where it's going and how to use it appropriately. But definitely apply for that Medicaid. Having that in your back pocket can help with additional funding down the road once you have those DMH support coordination services in place. Anybody does have benefits before the age of 18, make sure you're doing that redetermination review so that their benefits don't stop because they turn 18. So we want to make sure that we're going through that review once they hit 18, and it'll most likely be the income and the medical and making sure that you have that support from your medical doctor, submitting all of the different documentation that's requested to prove that that disability is in place. Along with that, sometimes Social Security will want to speak with the person themselves. So if they do that, really do try your hardest to make those appointments. They typically are fairly quick, but we want to make sure that, we are making those appointments and we are doing what we can to help get those, all those reviews and those forms filled out so that, somebody can have the best benefit coming in as necessary. When somebody does have those Social Security benefits in place and they're ready to work and they're out working and they're getting those paychecks, use your work incentives, use those IRWIs, make sure that they do meet all three of those criteria, that they are being submitted to Social Security in the month that they're used, so that you can get the most out of your benefit check. So remember, your benefit check, if you're getting $500 in your benefit check, that's always going to be in addition to your earnings. So if you're making $900 a month plus that $500, $1,400 is more than it would be without, those benefits in place. So again, it kind of just depends on each person's needs. If they do need to be in a place where they're earning their money and they're saving their money and maybe eventually, hopefully moving out on their own and they have those supports in place, it'll really help them really achieve their better life as they're moving forward. Make sure we're getting that support coordination from the regional office. Apply for their support. Get that HCBS waivers in place, and either of those that, like I said, usually that community support waiver or the comprehensive waiver are going to be the two that will help a lot of people who are 18 and older get those extra funding in place for transportation, for career supports, for day services, for residential services, respite. All of those can be funded under those waivers. And then as people are making money, as they have that extra income from their paycheck or from their benefit check, open that ABLE account to help save that money. But again, just like with IRWIs, just like with our pay stubs, we want to make sure that we are showing where any of that money that's being withdrawn is going towards. They don't need to be submitted to anywhere, but they just need to be documented so that if what I was told is from our program manager at ABLE is that they're never going to ask for any of that documentation. The IRS might ask for it. So we want to make sure that we have it ready to go in case somebody says, hey, can you show me what you spent this money you withdraw from the ABLE account on? That's where you're going to need to have that in place. Here are all the websites. A lot of them I mentioned throughout the presentation here. SocialSecurity.gov has a lot of information. The language is pretty plain. I mean, there's certain parts of the website that, it's a little more technical, but usually throughout there, it's pretty easy to understand, and they talk you through how to apply for different things, where to go for different things. Next one here is our SSI application. Next one here is, I think this takes us to our ticket to work that we spoke about. And then we have the DMH website and the MoABLE website. Oh, this is our IRWIs. So this, let me pop this over really fast. So this talks all about our IRWIs, our impairment related work expenses. And it helps, there's a list down here about them. And it talks a little bit about what they are, how to submit them, what you can use, what you can't use, and it gives you a couple different stories about using them as well. So that's a nice little website to kind of navigate through. And then the last one here is that MoABLE website, which will help you apply for an ABLE account. There's a great slideshow in there that'll give you more information about ABLE accounts as well. Use the slide decks, and then those websites are very helpful. And like I said, you all have my information as well to reach out if you needed anything.
Thank you so much for joining us, and thank you, Kristen, for sharing all this great information. And we look forward to seeing you at our next workshop. Thank you, everybody.